At Sway Health Live 24 in Atlanta, Georgia, Kristy Dickinson was the keynote patient speaker, and she was incredible. At the time, she was a newly minted football mom, and she used her journey of learning that sport as an analogy for how patients have to learn the healthcare system. I hope Kristy will have a few new football analogies for us as we sit down to answer a question that's been burning in my brain recently. What can we do to help rebuild trust in healthcare? Let's get to it.
Sway help.
Kristy, welcome to the program.
I'm so excited to be here. Thank you so much for the invite.
I'm so excited. I'm sad we're not in person, but I am so happy that we're getting this chance to catch up and talk about, I know your favorite, one of your favorite subjects, certainly one of my favorite topics, patient experience. But Kristy, maybe before we get deep into the topic, can you give our audience a little bit about you and what you do?
Sure. So I am a healthcare strategist or consultant. I work with clients who are looking at how they might be able to transform some of the work that they do, either in digital health innovation or in system transformation, integrated care pathway planning. All of it, I bring with me my patient experience lens. So I am first and foremost a rare disease patient. I live with some complex illnesses that was what got me into the healthcare space and sector. And unfortunately, out of a not so great diagnosis came a deep passion for making this system and the experience a little bit better than I found it.
Yeah, and I think because have to mention again, wonderful, amazing, inspiring keynote that you gave at the Sway Health Conference in 24 in Atlanta. You were a keynote and it was phenomenal. All the feedback was glowing. Speaking of stages, you were recently on stage. You spoke at the Class Patient Experience Summit. And I
Yes.
spoke to Adam Charrington recently. I'm now speaking with you. Can you share a little bit about what you spoke about at that summit?
Absolutely. That summit was incredible. What an experience. I still think about it a few months later. So I actually took a thread from the talk that I gave at Sway and pulled that through to the keynote that I gave with class in April. In that, I tied it to me being in my football mom era. So I think it's a good analogy, though, because you know, our healthcare system is so complex. So I talked the point of my keynote for the class summit was we need to adopt an innovator's mindset and really think beyond our playbook. So we've worked in healthcare with the same playbook for many, many, many years. And my challenge to the audiences that I speak with is how might we think about things a little bit differently? And I will always advocate for patients to be not just a token, a writing on the wall. Patients are at the center of everything that we do, but really, truly being co-design partners. So much like in football, where the players, you can't play the game without the players on the field. In healthcare, it's the same. You need the patients. Patients need to be included for our system to work efficiently and smoothly, I think, or seamlessly.
And Christy, in your mind, how does that patient engagement or patient involvement manifest? I mean, you talked a little bit about, tokenism, right? Where you just, have the
Mhm.
nice little placards on the wall and you have the posters here or there. But how does an organization look, behave, and seem when they truly are involving patients?
I think that, and I've seen some very good momentum forward in the last 5+ years. You can tell when an organization is co-designing with the community that they serve, whether or not it's patients or caregivers. I never want to leave caregivers out because when you're talking about pediatric populations, it's the caregivers that you need to be engaging with as well as the patients there. Um, but you know, from governance, who sits on your board, who is in your C-suite, who is helping direct and drive the projects that are priorities and deliverables for your organization that year. That real co-design has to start from the beginning. You don't just, all right, I'm going to take it back to the football analogy again, but I've said this a few times. Nike doesn't develop their football cleats or their cleats for their athletes and then bring in the athletes and have them try them on. They co-design with the athlete that is wearing it in the specific sport. And that healthcare shouldn't be any different. We see it in consumer packaged goods and other industries all the time. You wouldn't make anything without getting your consumer feedback. So I think there are some interesting ways to embed that voice right from the get-go.
So, and this is interesting because, first of all, I think most organizations have a PFAC, like a patient and family advisory council. I would
Mm-hmm.
include caregivers in that now. I think most people kind of acknowledge that, okay, caregivers need a voice too. And, they have regular meetings, there's coffee, there's donuts, there's cupcakes, right? I think we joke about that. And then they
Mm-hmm.
get that, to your point, I think what I'm realizing, but just from what you said, is that the organizations bring already formulated and created things for them to
Yeah.
comment on and to provide feedback on. Noble, but kind of misses the point. Like you should have
Yes.
designed it with them, not just ask them for commentary on it. That's what I'm hearing you say.
100%. I mean, anyone that's ever built anything or, marketers in your audience, how hard is it to change a campaign when you've already fully designed it? It's a lot of work, it's a lot of money, it's a lot of wasted resourcing. So when organizations will bring fully baked ideas to their PFACs, well, any feedback that we give you, what's the likelihood that it's going to be implemented? No one wants to build twice, and you know, we don't have the ability. Our system isn't built to do that. So,
I love it. I mean, and it's poignant because that's a very tangible a way to kind of talk about a co-design versus getting feedback. I mean,
mhm.
one is a nice first step, but now advocates like you and others are saying, look, that's great, but now we need to move to this co-design because you'll get better things out of it. Your systems you'll be smoother, your process will be more seamless. You'll
Yeah,
have patients who are more engaged in their health and not tying up maybe precious resources for things that you could have been avoided and so forth. So I like what I'm
absolutely.
hearing.
Yeah, and sometimes I've sat in groups where organizations think that they need to solve one problem. And when you speak to the group that you're solving for, it turns out that's actually not like, that's three steps down. We need to start back here.
So Kristy, if we go back to
Mhm.
your keynote at the class event, what were some of the other key messages that you had in your keynote that you tied to football?
So I talked about I'm really learning and I've come a long way. I'm going to tell you, Colin, from the first time I chatted about this. I really deeply understand that game now. Still a long way to go, but you can't operate in a silo in football. You can't win that game alone. It takes, I think, 53 or 56 players to all work cohesively, to understand the playbook, which means that the coaches have to coach each of them and be all on the same page. And, one layer up, the GM and the owner of the team have to be. So that's communication and that's collaboration and that's trust. And those three pillars can 100% be brought, brought brought forward in healthcare. We should be operating in a collaborative environment that is built on trust and psychological safety, and we should be working, cohesively as a team. When our clinicians are less burnt out, patients receive better care. When our pharmaceutical partners can have easier recruitment into clinical trials, ultimately our healthcare system benefits. We really all do need to work better together.
Oh, yeah, and you mentioned a word there that I think is becoming a little bit very poignant right now, and that it's trust in healthcare. Trust as you mentioned, between employee and employer, trust
Mhm.
between patient and physician and clinicians, trust between patients and I'll call it the system.
Yes,
And I think the trust between patients and clinicians and the system of healthcare is really in really bad spot right now. Would you
absolutely.
agree?
Yeah, I would say we're at a crisis point.
And so again, a question around, is there anything tangible or something we could do to start to maybe turn the tide a little bit on that? I mean, anything at all?
When I think about what builds a good, trusting relationship, it's honesty and transparency. And so, for a long time, the power imbalance in healthcare has been a patient would go into a clinician's office and be told, this is what you're going to do, and then they would leave. And so, I see an opportunity there where we know patients and caregivers are doing a lot of self education, and where they get their information from is important. So I feel for clinicians, for systems, for researchers that have to battle misinformation, that have to work to gather that trust where maybe they hadn't had to work so hard before because of the competing messaging. For a long time, I have heard don't give patients their data. Patients don't know what to do with it. People need to be, spoon fed. That's not the case anymore, right? And I think if you have an open and honest and transparent conversation with another human being, take away your titles, human to human, that's a connection. And those connections layer on each other to where you've got a relationship that is built on trust. But it takes effort, and it takes more than just a 5 minute, I can only talk to you about one thing today because I I'm only, I'm not a human, I'm just a diagnosis, or I'm just here for this. The system just hasn't been structured. And that's, I do want to say that is not a slam. I am not slamming our clinicians. I feel for them having to work within a system that wasn't built for them to treat human beings holistically.
So for our audience specifically, as you know, the healthcare marketing audience, is there anything that
Mhm.
marketers can do or any ideas that you have for marketers to consider of how to rebuild some of this lost trust between
Yes.
patients and the system and clinicians in the system?
So for patients, I think use plain language.
Hmm.
Like that's something so easy that I think sometimes gets overlooked because you and I know there's a lot of jargon and healthcare is very complex. But let's look at who you're talking to. How are you communicating? How are you delivering the education and the content? Where are you reaching them? Um, have you engaged with patients and caregivers? What's meaningful to them? We're in such a um, I think an unfortunate cycle where you've got like I don't you would know better than me what the stats are and the attention span of human beings at this point, but my kids just keep telling me it's TLDR like when I try and talk to them. Stop, mom. We're too long and we're not listening. So, meeting people where they're at, right? I want to communicate clearly. Here's the benefits, and if you need more education, here's a trusted place to go, or here's why this is important. Like get to the crux of it. And I don't know, I say tell the truth and tell it fast.
I like that. That's good advice. That's good advice in general for marketing, but particularly in healthcare. I also think, to add on to what you said, you mentioned it, meeting patients where they are, right? And I think that means their language, their preferred
Mhm.
language,
Yes.
having the ad or the materials available where they go to get their healthcare advice. I've heard sometimes that's a barber shop, sometimes it's
Yes.
the local restaurants, sometimes it's the church, right? You have to meet them there because that is where they're asking their peers and their trusted ones
Mhm.
for medical advice. And if you can be there too, then you can become a voice that they trust along with those other folks.
Absolutely. I think it's never where we think it's going to be. So we think if we put a brochure in the doctor's office, we've done our job. But I would say, and you just covered like 6 to 10 different places where we have an opportunity to reach them in a more meaningful way.
And Well, yeah, I mean, and I think that's, I mean, I think some progressive organizations have gotten there. I know, actually, I met one
Yes.
at the class summit the year before when I was there that was trying to do these kinds of things to try and really figure out in the community who was the trusted voice and then engage them in co-design and how to
Hmm.
reach that particular community. So, but, I think overall, though, I mean, we're at a time, yes, where trust has eroded. The answers seemingly are simple things that we can do, and yet with the economic environment that we find ourselves in, um, it, it's not a great time to, at least according to the executives, not a great time to launch new initiatives. Patient experience, it is one of these, I'll call it more fluffier areas of
Yes.
healthcare or seemingly fluffy areas of healthcare. So I feel it's always in danger of being deprioritized when times get tough. Um, why do you think it might be a mistake to deprioritize the patient experience, even though times may be a little bit
Yeah.
difficult?
So I would challenge you that it not might be, how do I say this? It is a mistake. Not that it
Mm.
might be a mistake, it is a mistake because, again, we're not looking like patient experience, if it's done right, isn't a one and done. You are looking at how do I build a long-term connection with the community that I'm serving. And that takes, going back to the trust, that takes time. And so when you deprioritize these initiatives, that stops that relationship from forming, which ultimately will lead to not the best outcomes that we are looking for. So I think part of the reason why patient experience is on the chopping block a lot of the time is that it's hard to quantify. And executives and organizations really love return on investment and KPIs and data. So I'm always challenging, like, if you do this work right, it is embedded in your strategic initiatives and in your deliverables from the get-go. That's not something that you can cut, because without these voices, you couldn't build that product. Without these voices, you couldn't launch that program. It can't be an add-on. It's not a bolt-on at the end. It's got to be embedded from the beginning. And we know that an engaged patient or a caregiver, an educated patient or caregiver, leads to better health outcomes, leads to less stress and strain on our system. It's a windier road to get there than I spent $1 on this ad and I got 3 leads from it.
Yeah. And I think one argument I hear a lot, um, maybe not articulated, but unsaid, implied, would be that, well, in a lot of cases, unfortunately, they're the only game in town. The one provider is the only one available in a very
Mhm.
large catchment area. So it's not like they have competition. Like, where else are these people going to go? And as